Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Vice President Professor Yemi Osinbajo calls for more funding and support for local manufacturing capacity to achieve self-sufficiency in pharmaceuticals. European Union calls for access to more food as part of global response to the COVID-19 pandemic, especially the vulnerable in Taraba. Zimbabwe, Egypt join other African countries making vaccines compulsory for public service workers. Global death figures from the coronavirus has surpassed 4.9 million, according to Johns Hopkins Coronavirus Resource Center. Of that number, 33 deaths were recorded in Nigeria last night and also 125 new confirmed cases. This leaves the death toll in the country at 2,837, and the total cases till date at 209,298 in the 36 states and the Federal Capital Territory. Let's begin more on the virus update.
5 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 9 states and the FCT, a drop from the figures reported earlier. FCT logged the highest infections with 45 cases. Kaduna had 34, Rivers 11, while Lagos and Osun registered 10 cases each. Other states including Oyo, Jigawa, Edo, Kano and Plateau registered a single-digit infection. The latest data includes a backlog of 45 cases and 5 recoveries in the FCT for October 16th and 17th. The overall count of confirmed cases in Nigeria now stands at 209,298. 59 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 197,143. Lagos accounts for the state with the highest number of cases currently on admission, followed by the FCT, Delta, Oyo, and Akwa Ibom. 33 patients have died from complications in the last 24 hours, raising the fatality toll to 2,837. Currently, there are more than 9,000 active cases in Nigeria, while over 3 million samples have been tested so far. More than 5.3 million eligible Nigerians targeted for vaccinations have been reached with the first dose, while over 2.6 million persons have been fully vaccinated so far. In Africa, there are more than 8.4 million confirmed cases and over 215,000 deaths have been recorded across countries on the continent. The total global confirmed cases have surpassed 240 million, while deaths are beyond 4.9 million.
So thank you. I think in the last 5 years, I have been privileged to work with an incredible group of Nigerians that have gone over and beyond time and time again. I will miss their energy, I will miss the engagement with Nigerians, and like has been said today, I will miss demonstrating that we actually have a great country. But at the same time, I look forward to this agency growing from strength to strength. Yes, we have moved a bit in the past 5 years, but I think the limits are still incredibly, there's still a lot of work to do, and I trust the team to continue on that path.
That is the NCDC DG's response to a question I asked him a few weeks ago about what he would miss most about DG. And today was that time when the outgoing Director General, Dr. Chikwe Hekwazu, officially hands over his duties to the incoming Director General, Dr. Ifedayo Adetifa. Nigeria's Dr. Chikwe Hekwazu was appointed Assistant Director General of the World Health Organization in charge of health emergency intelligence, which takes effect from November 1, 2021. In a statement by the agency, it's a transition in leadership as they continue to reflect on the collective efforts in building an effective institution and strengthening capacity for national and global health security. And researchers in Nigeria appear not to be backing down on the global efforts to manage the spread of COVID-19 as 2 out of 4 medicines for the treatment of the virus undergo clinical trial. The Director General of the National Institute for Pharmaceutical Research and Development, NIPRID, stated this at the ongoing conference on health access and socio-economic development in Abuja. Meanwhile, Nigeria's Vice President is calling for more funding and proactive support for local manufacturing capacity in order to achieve self-sufficiency in pharmaceutical products.
Think what would have happened to India, which has reported the most number of infections in the world after the United States, if it did not have the capacity to produce its own vaccines. It is this proactive approach that we must take to the slow pace of vaccine access in Africa and, of course, Nigeria. So it's evident that the way forward is more funding for healthcare and research, for our innovators, and to develop solutions in pharmaceuticals and medical consumables. To date, our administration has established the Healthcare Sector Intervention Fund Facility, which has disbursed about $76.98 billion, that's about $185 million, to finance the acquisition and installation of critical medical care equipment, as well as the expansion of production lines in various pharmaceutical companies across the country. The CBN is also supporting a number of research and development initiatives in the health sector. In all, I believe the CBN has disbursed a total of $233 billion in grants. These have been disbursed to various companies. Nigeria, and I know that Professor Tomori is very well aware of this, is in talks with the World Bank on the private lending arm and other lenders to raise about $30 million to help finance a vaccine plant.
Vice President Professor Yemo Shibajo. Meanwhile, the Presidential Steering Committee on COVID-19 has updated its travel protocol for international travelers into Nigeria to take effect from Monday, October 25th, 2021. Travelers arriving in Nigeria must present the COVID-19 PCR test result conducted 72 hours before boarding. Unvaccinated and partially vaccinated inbound passengers will be required to observe the mandatory 7-day self-isolation but do a COVID-19 PCR test on days 2 and 7 after arrival, while fully vaccinated inbound passengers will not be required to observe the mandatory 7-day self-isolation, but to do a COVID-19 PCR test on days 2 of arrival. Well, for those on business trips or official duty staying less than 7 days, they must be fully vaccinated, produce a negative PCR test 72 hours before boarding, and conduct a PCR test on day 2 of arrival. According to Mr. Boss Mustafa, the chairman of the committee, the review protocol is based on science, national experience, and global development. And the European Union says preserving access to safe and nutritious food is and will continue to be an essential part of the response to the COVID-19 pandemic, particularly for vulnerable communities hit by the pandemic. According to the European Union, over 2 million people do not have regular access to safe, nutritious and sufficient food at the moment, stressing that COVID-19 could add between 80 to 135 million people to the figure. Represented by the Public Relations Officer, the EU insists that the COVID-19 global health crisis has now become a time to reflect, rekindle and appreciate things truly cherished.
The COVID-19 pandemic has underlined an urgent change of route and has made it even harder for farmers already gripping with climate variability and extreme to sell their harvest. While rising poverty is pushing an increased number of people to require emergency food aid, as it is evident that the number of residents to use food banks, that's the processed grain banks, in the 2021 lean period. The World Agri-Food System currently employs 1 billion people, more than any other sector. Stakeholders, smallholder farmers produce more than 33% of the world food, despite the challenges including poverty and lack of access to finance, training and technology. The European Union, through its various interventions, is in the forefront to ensure that this happens. Through our intervention, we ensure continuous advocacy among relevant stakeholders for sustainable agri-food system that will deliver food security, resilience, and nutrition for all, without compromising the economic, social, and environmental basis for generations to come that lead to better production, better nutrition, a better environment, and a better life for all.
And as the onslaught against COVID-19 continues across the country, there is a call on diagnosis centers to stop sharp practices or face the wrath of the law. From Radiographers Board of Nigeria under the Federal Ministry of Health to members of the Association of Medical Laboratory Sciences, they are calling for more monitoring and enforcement of standards in diagnostic centers across the country to discourage quackery. And joining us to talk more about this is Professor James Damen. He's the president and National Association of Medical Laboratory Scientists. He joins us virtually. Thank you, Prof. Thank you for joining us on the program.
Yeah, thank you. Good evening, viewers.
Good evening. I'd like to begin by asking how the medical laboratory science community is essentially contributing to solving problems, improve the health sector, and this is in the midst of the COVID-19 pandemic.
Yeah, okay. I thank you very much for that question. You know that medical laboratory science is actually the bedrock of modern medicine. And the World Health Organization emphasizes that all treatment of diseases must have to be evidence-based. You can only get the evidence from a medical laboratory. And that is why we are actually more concerned about the state of the laboratory in this country. Our position has been that all laboratories in this country has to be accredited. The essence of having an accredited laboratory means that for any result that is actually released from accredited laboratory, it is accurate, it is correct, it is reliable, and it can be reproducible in any part of the world. And globally, if you have a lab that is not accredited, which means that the quality of that result is not, you are not sure of the result is not accurate. And so we advocate that government, as aware of improving our health services, must enforce policy to ensure that if you must open a medical laboratory, whether a stand-alone laboratory or the laboratory is in a hospital, it has to be accredited so that we can be sure of the quality of results that are actually produced there. The essence of also having accredited laboratories is that patients can also have confidence in whatever result they are obtaining, and then for whatever money they are even paying for investigation, they are sure of getting a qualitative result. And also from my own background from the university, if you conduct a research and that research is conducted in a laboratory that is not accredited, there are many journals that they cannot accept that article for publication. And so the business of actually having quality health services actually starts from the laboratory. And so if we get it right from the laboratory, it will go a long way in strengthening the health system that we have. You are all aware that even this COVID-19 that has ravaged the whole world, the challenges we first had was actually the issue of how can this be diagnosed? Because the presentation of COVID-19 is actually similar with other infectious diseases. So it is only in the laboratory that you can actually authenticate that yes, this presentation or that this patient has is actually caused by COVID-19. And there are many factors that can actually make you to have false results. Beginning from even the reagents that have been imported, even the equipment.
We're talking to Professor James Damen, the president of the National Association of Medical Laboratory Scientists. But let's take you to Delta State, where Governor Ifeanyi Okowa has been speaking on the negative effect of the COVID-19 pandemic, where a chunk of government resources meant for developing projects is being devoted to the fighting and containing of the spread of the virus. Well, he was speaking at the 19th International Civil Engineering Conference and Annual General Meeting with the theme Civil Infrastructure Development, Challenges and Prospects. under pandemic situations in Asaba Delta State. He called for the creation of public-private partnership financing models that will accelerate infrastructure development in the aftermath of the impact.
With a theme that clearly reflects on the reality of how COVID-19 pandemic has taken a toll on infrastructure development in the country, members of Nigerian Institution of Civil Engineers are gathered here for the 19th International Civil Engineering Conference with Governor Ifeanyi Okowa of Delta State as a special guest. This annual conference has been organized to enable the engineers meet to discuss situations that affect the society and proffer solutions to them. In this case, the effect of pandemic which has disrupted living conditions and economies of many countries.
We are all aware of the impact of COVID-19 on lives and businesses globally since its outbreak. From the qualities of well-researched papers that will be presented in this conference, I have no doubt that the communique for this year's conference will be highly beneficial to the participants and the entire nation, Nigeria.
The keynote speaker stresses that the government's capacity to deliver on key infrastructure had been hampered by the pandemic. He recommends the creation of public-private partnership models to accelerate infrastructure development and promote inclusiveness.
The government capacity to continuously deliver on its core responsibility of providing civil infrastructure is drastically hampered by the COVID-19 pandemic. Also, the old ways of providing infrastructure are changing so much that we need to acquire new skills and mindsets, including perhaps learning new languages to benefit from the funding mechanism arising from low revenue accruing to the nation.
Governor Okowa says the pandemic has also stalled development projects across the nation. He is asking engineers in the country to study constantly to update their skills in order to adapt to rising challenges in the face of the pandemic.
The theme for this conference, Civil Engineering Development, Challenges and Prospects under Pandemic Situations, is quite apt. It goes without saying that the COVID-19 pandemic not only disrupted our living conditions and altered our social relationships, it also sent the world economy crashing to levels not experienced for at least 100 years. Development projects were stalled as government spending was severely hampered because a large chunk of available resources was devoted to fighting and containing the virus. The journey to recovery and reconstruction as the world learns to live with the virus will tax the ingenuity and resourcefulness of political and business leaders all over the world.
The high point of the event is the decoration of the governor as an honorary fellow of the institute, as well as the best performing governor in infrastructural development in Nigeria for the year 2021.
Away from Nigeria, union leaders have angrily reacted to the Zimbabwean government's announcement Sunday that workers who have not been vaccinated against COVID-19 will no longer be allowed at work and will not be paid. This is seen as part of efforts to deal with high vaccination hesitancy in the southern African nation. Ndabi Ngi Mangwana, Zimbabwe's Secretary for Information, over the weekend told government-controlled media that all civil servants who have not been vaccinated against COVID-19 will not be allowed to work come today, Monday. Nigel Yamutumbo is a journalist there, and he joins me now virtually. Thanks, Nigel. So the policy used to be if you do not work, you don't get paid. But that now appears to be if you're not vaccinated, you don't come to work, and hence you're not paid. How are workers reacting?
Well, certainly the announcement by the government spokesperson and by the COVID-19 task force lead in Zimbabwe is simply a follow-up to what is obtained in the statute. The timeline in terms of the rollout of the COVID-19 pandemic really spoke to how government was going to enforce compulsory vaccination for its workers, for the civil servants. So essentially the move now is to implement what was said before. Trade unions and so forth had already challenged compulsory vaccinations. And now we're at a point where government has said, hey, we're not just talking of a policy we're going to implement. If you are not vaccinated, do not report for duty.
Is anyone planning to sue the government, unions, for example?
Yes, there have been certain remarks. First, the first challenge is to challenge the promulgation, the statute that gives government the powers to force those that are not vaccinated on unpaid leave or to essentially discipline those that would not get the job as a manner of pretty much implementing the compulsory. So the first challenge that has been muted or that is being put across is to challenge compulsory vaccination. But I would imagine that there would be a second legal action to challenge the enforcement of that provision and the particular workers that have been affected. Part of it due to logistical issues. The vaccination program, the rollout was not as smooth as one would have imagined. And others could also be about hesitancy, religious beliefs, and so forth. And all that has to be taken in cognizance of the workers' rights. It has to be taken in cognizance of how government ought to use dialogue and persuasive methods to ensure that citizens voluntarily get vaccinated, in particular civil servants. So I would imagine workers do have a case, and they may table that particular case within the court. But there's already another one challenging the provision on compulsory vaccination.
Indeed, and Nigel, it's also interesting that the school teachers, they constitute the largest population of Zimbabwe civil servants. They're saying the government hasn't explained to members how vaccination would assist them in terms of boosting their immunity. But if we look at how much vaccines or vaccinees are on the continent, African continent at the moment, in terms of the shipments Zimbabwe has as of now or today, is that enough? Is there enough to go around?
Certainly not enough, in particular when you look at the rural areas. Yes, the vaccination program, there was a time when there was a real momentum. There was a time when you had quite a couple of citizens rather heeding the call to get vaccinated. There were quite a couple more centers, particularly in the urban areas, in which people could go and get vaccinated with little or no logistical issues and so forth. But there are real challenges, particularly in the rural areas, where there's a question, number one, of awareness as to the rollout of the program. Secondly, there is also the issue of distance. There's also the issue of the transportation and so forth, which now is really making the rate of vaccinations slightly dwindle from the time the rollout started. There were also issues initially also in terms of the dosages that had come to Zimbabwe vis-a-vis the population, which is still insignificant if we are to if we are to hit the herd immunity insofar as the vaccination is concerned. So partly, yes, government wants to ensure all its workers are vaccinated, but it also has to play its part to ensure that the right to be vaccinated pursues the citizen, and the citizen does not necessarily have to pursue, especially when it comes to those living in the rural areas.
Nigel, thank you so much. Nigel Yamutumba, journalist joining us from Zimbabwe. All the best.
Pleasure. Thank you.
Egypt, thanks a lot. And Egypt will bar unvaccinated public service workers from entering government buildings from mid-next month. A cabinet notice said that workers would have to be vaccinated or take a weekly COVID test to be allowed into government buildings from the 15th of November. The cabinet also allowed the opening up of bathrooms in mosques from Wednesday. The bathrooms were closed in March last year as part of measures to contain the spread of the virus. Here's more on the global updates.
Russia reported 34,303 cases of new coronavirus infections in the past 24 hours, a record high number since the start of the pandemic, data from the State Coronavirus Task Force revealed on Sunday. It also reported 997 deaths from the disease, 5 fewer than the daily record high of 1,002 reported the previous day. The latest coronavirus deaths brought the official national death toll to 223,312, with a total of almost 8 million cases. Children over 3 years of age have started receiving their COVID-19 jabs in Buenos Aires, province, Argentina. More than 450 health workers will apply the Sinopharm vaccine to children ages between 3 and 11, approved for use on kids by Argentina's Drug and Medical Device Regulating Agency, ANMAT. According to the Argentine government, COVID-19 cases have been decreasing in the region for 20 consecutive weeks, representing a drop of 97.3% from its peak. The Philippines has also started inoculating 12 to 17-year-olds with underlying conditions against COVID-19 as it ramps vaccination amidst the spread of the Delta variant. An initial 60 teens received their first dose of the Pfizer vaccine at a Manila hospital, with more expected to be vaccinated in the coming weeks. The National Health Department, which is grappling with a shortage of vaccines, eventually hopes to vaccinate all minors as well as expand the campaign to other parts of the country.
We'll continue to take responsibility. You can visit our websites for more updates, breaking news, and you can find a better understanding of the coronavirus pandemic. Our top story there, Russia topping 1,000 daily COVID cases. It's channelcv.com. That's the program this evening. Thank you for watching. I'm Millicent Nwonka. Stay healthy.